Hello, and welcome to American English Medellin. I'm Profi Nguyen, a certified English professor in Medellin, Colombia, and thanks for joining me today for the USMLE overview. As you may know, the USMLE stands for United States Medical Licensing Exam. This is a three-step certification procedure, including three separate tests. International students are encouraged and must complete these three tests within a 7-year period. The test covers scientific and clinical knowledge, and the last test covers live doctor-patient scenarios. The exam is totally in English, and you need clear English to pass each of the exams. And as well, you need really an upper intermediate knowledge of, or an upper intermediate level of English to also pass the exams. Let's look at step 1. You must demonstrate a mastery of basic science to practice medicine. The test also covers scientific principles for lifelong learning. Parts of this test are computer-based. In step 2, you also must demonstrate medical knowledge, skills, and understanding of clinical science, essential for the provision of patient care. You also are tested on principles of clinical sciences and basic patient-centered skills for the safe and competent practice of medicine. Like step 1, parts of the exam are computer-based. Step 3. In step 3, you're tested on your medical knowledge and understanding of biomedical and clinical science, essential for the unsupervised practice of medicine. And the last part is one of the most difficult parts of step 3 and one of the most difficult parts of the whole USMLE certification. And that is the part that tests your, what we call your bedside manner, the interaction between you and the patient. There are 12 cases which cover 4 hours. So you have 12 patient scenarios. And in each of those scenarios, you also must write a patient note describing the diagnosis and possible symptoms that the patient has and possible problems that the patient may have. All right, well, let's go ahead and take a recap of the lessons we've covered, the information we have covered today. More doctors are wanting to practice in the United States, and that's also increasing the demand for USMLE certification. Let's face it, the USMLE is a tough test. It evaluates your doctor knowledge, but more difficulty that students face is the bedside manner, and that is your relationship with the patient, which is tested in step 3 with the 12 scenarios. I am Professor Nguyen, a certified English professor in Medellin, Colombia. I would like to thank you today for joining me for this overview of the USMLE certification. I would appreciate it if you would click on the link at the bottom of this video and sign up for my weekly newsletter, which will bring you extra tips in English each week to your inbox. Well, I am Professor Nguyen, and until the next time, I salute your English success.